AMH, anti-Mullerian hormone. This video is very important for women in today's world as more and more women are choosing to delay their pregnancy plans while they are prioritizing their career or pursuing higher education. Hi friends, this is Dr. Rajeshwari Reddy. I am a senior obstetrician and a gynecologist and a laparoscopic surgeon from Hyderabad. So, what is AMH? AMH is a short form for anti-Mullerian hormone. It is a hormone test done to know about the ovarian reserve of a woman. So, ovarian reserve of a woman is basically her ability to produce eggs. The number of follicles in any woman is determined at birth and cannot be increased by any medication or any natural things. So, by doing this test, women can have an understanding of how much ovarian reserve is left and can make decisions on their pregnancy plans. So, how is this test done? This test is done by a simple blood sample, usually the sample being taken from the arm. AMH starts rising from puberty and it starts reducing at around the age of 35 years and it disappears at menopause. So, what are the prerequisites for the test? Not to take any ovulation induction drugs, not to take any alcohol, smoking or deep fried food at least 4 to 5 days before the test. So, once the test results come, how do we interpret it? About 1.5 to 4 nanogram per ml is the normal AMH that has to be there between the age of say around 15 to 35. Anything between 1 to 1.5 nanogram per ml is low level. Anything less than 1.1 would be low of the normal, and anything lesser than 0.5 is like very low. So, anything which is more than 4 nanogram is a very high AMH. So, what is the use of this test? It basically tells us the pool of eggs that are remaining in the ovary of a woman. Usually, AMH goes down with increasing age. So, let us see what are the shortcomings of AMH test. A AMH test only tells us the number of eggs that are left. It has no information about the quality of eggs. It also doesn't give any indication of a IVF or any assisted reproductive methods being successful or failure. What I mean is, if a AMH is high doesn't mean the IVF will be successful. So, low AMH. It doesn't say you cannot absolutely conceive, but you may have difficulty conceiving. So, one needs to hurry up with treatment and not wait and watch when the result of their AMH test tells them that it is at a very low level. However, there are a few small things that we can do to just improve the quality of egg, as in correct the vitamin D level, correct the vitamin B12 level if there is any deficiency, have exposure to sun, eat healthy foods, eat seafoods like salmon rich in vitamin D, use DHEA supplements for at least 3 months. It is seen that to help the quality of egg, coenzyme Q is recommended. This medicine also seems to help improve cell function in a follicle. Regular exercise, improved lifestyle definitely do help. Stop smoking and alcohol intake if you already are doing it. Switch to healthy diet, reduce your stress level. Reducing the emotional stress as well as the physical stress is very important. Always remember that there's nothing much to do in a reduced AMH patient. So, do not delay plans for pregnancy. We also advise AMH before any ovary related surgery, as in a endometrioma or a dermoid cyst or sometimes a large ovarian cyst, so that we know the baseline, or even sometimes when we are just doing a diagnostic laparoscopy and coincidentally we see endometriosis during the laparoscopic surgery, even then we advise AMH. and advise patient accordingly for their future plan for fertility based on what we see in the AMH report. So now let us see what are the reasons for decreased AMH while the patient is still young. First thing, aging naturally decreases the AMH, which is around 35 years plus. Then in 10 to 20% of the cases, it is idiopathic, as in we don't know the cause. Ovarian diseases like chocolate cyst or any kind of ovarian cyst may also decrease AMH. Any history of chemotherapy or radiotherapy or sometimes autoimmune diseases, and these days we also see food adulteration, inadequate sleep, stress, high stress life, A type of personality, all seem to reduce AMH. There are also some situations where AMH is falsely high, where we get misguided, and this usually we see in polycystic ovaries or sometimes in hyperstimulation cycles of ovulation induction, and we also see high AMH in certain ovarian tumors and ovarian cancers. So clinical correlation and discussion with your gynecologist is a must when you get a AMH test done. So when you get a AMH test done and you have to read the interpretation, don't just sit at home and read the interpretation. Like suppose if your AMH is like 4 or 5, and don't just relax thinking that it's high. Clinical correlation with your existing situation of your ovary, age factors and previous ovarian surgeries. I mean, there are many clinical things that you need to correlate with the AMH results. So kindly consult your gynecologist, properly interpret the AMH report and then plan the treatment ahead. Thank you.